name is Kiersten Shyian. My student number is T00678685, and today I am doing the skeletal anatomy joint assignment with this lovely pig leg. So I'm going to go down the list of terms. So this is, first of all, this is the femur. This is the head of the femur, so that would go into the body this way. So this would be the right leg of the pig. We go through our terms. Our diaphysis is basically the long part of the bone, kind of all of this general area. The epiphysis would be the ends of the bones. And the epiphyseal plate is kind of this dark line right here, or a growth plate is also what that's called. The cortex or compact bone exists kind of here on the outsides, whereas the cancellous and spongy bone exists more at the ends of the bones. You can tell that there's a difference between the compact and the cancellous bone. In here we have our bone marrow. So all of this delicious stuff right there is the bone marrow. And then the cavity that it is in is called your medulla or your medullary cavity. We can also discuss the periosteum, which is the outside covering of the bone, whereas your endosteum would be your inside covering of your bone there. The joint capsule, generalized, you would have your joint capsule encasing both of your joint, or your joint here, encasing both of those bones. Your joint capsule would be lined with your synovial membrane, and then your synovial membrane would include, or would encapsulate your synovial fluid. If we look here, this would be our articular cartilage. This articular cartilage is also hyaline cartilage. So hyaline cartilage and articular cartilage is hyaline cartilage, but not all hyaline cartilage is articular cartilage. The meniscus of the bone would be this lovely piece under here. So you have this like half moon shaped cartilage, which would be your meniscus. If we put the bone back together and we look at it from this angle, so this would be our medial side, this would be our lateral side, this would be our lateral condyle, this would be your medial condyle, this would be, this bump up here would be your medial epicondyle, and this bump over here would be your lateral epicondyle. This part is your kneecap or your patella, that big chunk of cartilage there. Excuse me, chunk of bone, I suppose, cartilage bone. Your trochlear groove would exist here. If you look at these, this is obviously, so this is your tibia, and this is your fibula, the small bone. Your fibula is located lateral to your fibia. My apologies, your tibia. If we were to look at the tibial crest, that would exist along the cranial portion of the bone. So it's this big crest here, kind of under all of this muscle. Excuse me. And then up here, this like general projection would be your tibial tuberosity. And then if we go for the ligaments, we do this. If I hold it the right way, then your patellar ligament is kind of what is holding your patella in place. So that would be essentially this ligament here. And then we have the anterior and posterior cruciate ligaments. So, excuse me, go on. So we've got the posterior cruciate ligament here, and then on this side we have the we have the anterior cruciate ligament, which is kind of, they should run kind of under or along this part here. And then you would have the collateral ligaments. Collateral means there's two of them, where they're paired. So you would have your, your medial collateral ligament here, which is kind of what is attaching it to the other bone. And then you would have your lateral collateral ligament here, which is on the side of the bone here. And and then the nutrient foramen should exist probably roughly around here on the femur. Foramen is just a hole, and the nutrient foramen basically is where all of the blood vessels and arteries and nerves go into, and they're what helps actually feed the bone. We can explain a drawer test. So a drawer test is used to determine if there is a tear in the cranial cruciate ligament. So you would basically palpate, and you would try to push the end of your femur cranial, and then you would push the tibia area caudally, so that if there is a slip and the femur actually moves over the tibia, then you would know that the CCL, or cranial cruciate ligament, is torn. So that is why they would use a drawer test, is to determine whether or not that is torn. And then between human and veterinary nomenclature, we do discuss things as anterior and posterior, usually in humans, sorry. Is the relative location of the ligament in the knee or in the leg. Whereas if we were going to do it for a four-legged animal, we would use cranial and caudal to determine the anatomical position of where that ligament would be, whether it's anterior cranial or posterior caudal. Thanks.